I got Sculptra a year ago and I don't look like me anymore. My face looks like a bloated pufferfish. What can I do? I've had the worst reaction from 2 vials of Sculptra. Do not do it. It is not reversible if you have issues like I do. Will Sculptra make me look unnatural? What if I don't like the result? What if I build up too much collagen and I look weird? If I get filler and I don't like it, at least I can dissolve it.
Hi, my name is Emily Dowe, and I'm a board-certified PA who specializes in aesthetic medicine. And Sculptra is one of the most popular treatments that I do. I've been a big fan of it, and I've been treating patients with it for over a decade. And I'm a regular user of it myself. It's one of my favorite must-have treatments. You are correct if you thought that Sculptra cannot be reversed. So there's a few things you need to know before you decide to get treatment. And the first is that Sculptra is not a filler. And because it's not a filler, it's highly unlikely that it's going to make you look
Like this. These celebrities likely had filler done, and thankfully, there's an antidote for hyaluronic acid filler, and you can dissolve it with an enzyme if you've come to the realization that you don't look natural or that you don't like the way it looks. As many people and celebrities have done, they were able to reverse their filler.
If you're doing research online about Sculptra, you probably come across a lot of blogs and websites that call Sculptra a type of filler, like it did here, according to the Cleveland Clinic. They say Sculptra is a type of dermal filler.
Or sometimes you'll hear people call it a biostimulatory filler, like in this article from Allure magazine where they liken it to Radius and Belafil. Sculptra is not like these injectable products because it does not give you instant long-lasting results, but these two products can, which is why you can technically call them biostimulatory fillers.
And I think that's what is causing a lot of confusion in people thinking that you're going to need to reverse it just in case you end up looking overdone or end up looking weird. Sculptra and filler can have similar goals in that they can both restore volume and they can lessen fine lines and wrinkles. And Sculptra does not have a magic eraser antidote like filler does. But the thing is that Sculptra doesn't usually cause this type of unnatural look because it's not a filler. It's a biostimulator.
Filler, which is usually made of hyaluronic acid, comes ready to go. You inject it into the skin and it gives you instant visible results. It can be used to restore lost volume that happens from aging, like we did in this case. We did 4 syringes of filler. And because filler is a gel, it's able to push beyond your natural anatomy when we want to enhance features like your lips, your chin, your jawline, your nose. On the other hand, because it's a gel, the more filler you put into the skin tissue, the stiffer your tissue will look. And we've all seen that this can result in an unnatural look. The properties of Sculptra are completely different. Sculptra comes in a vial, and inside this vial is a powder which contains tiny microparticles of poly-L-lactic acid. You mix Sculptra with water, and because it's mixed with water, it allows these particles to really spread inside our skin. A good analogy is that we're laying down fertilizer where we want your own collagen and elastin to grow. This is why we ask that you massage after Sculptra. We want those microparticles of fertilizer to distribute evenly and not get clumped together. So essentially, you want those particles to spread or migrate.
The results you see immediately after Sculptra are temporary and due to the water that you mix in the vial, and you go completely back to baseline in 3 to 5 days, depending on how many vials you got injected. So your results right after treatment are not your true results. Your real results take 3 full months to see.
So let's compare. Filler gives you instant volume enhancement, which come from the hyaluronic acid gel taking up space in your skin tissue. Able to go beyond your natural anatomy to expand your natural tissue, which may have the potential of giving your skin a firmer appearance, especially if too much volume is injected or too much filler accumulates in your skin or the filler attracts too much water. Can be dissolved with an enzyme hyaluronidase. Sculptra does not give you instant volume. Results take around 3 months. Results are very natural looking, and any firming or plumping you notice is your own and from your own collagen and elastin being produced, cannot be reversed.
So the results from Sculptra are from your own collagen and elastin being produced. So why would you want your own collagen and elastin to be reversed? In the instance where the woman says she looks like a puffer fish after getting Sculptra, I have 2 questions. 1, did she gain weight? She looks like she has a pretty full face already. at least to the central area of her face from what I can see. And her face is round, and people with round faces don't usually have as much definition to their facial features compared to other facial shapes, because people with round facial shapes usually have more of an abundance of fat to their face. So if she gained weight during the 3 to 4 months that she was waiting for her results, the weight gain plus the addition of added collagen can thicken the skin. And this is why I commonly ask patients if they had a change to their weight at their follow-up appointments. Second question, where on the face did she get treated with Sculptra, and how many vials did she get treated with? Sculptra can make your face look fuller, but the results would be more than likely natural looking, resulting from your own collagen and elastin and not from a gel substance sitting in your skin like it would be if you had filler.
When we're younger, especially in our late teens and early 20s, our skin is full of facial fat and collagen. And this is why when we're younger, our faces don't have as much definition compared to when we get older.
But I can't see Sculptra making someone look unnatural.
As a matter of fact, if you search the internet to see what celebrities have overdone it with plastic surgery or filler, you can find loads of articles and blogs with people speculating.
And I say speculating because celebrities rarely admit to anything when it comes to plastic surgery and injectables. But the reason why we can speculate when someone looks unnatural is because plastic surgery and filler can give more dramatic results.
And they have the ability to really augment your facial features, and this is why we use filler when we want to enhance our features.
But if you do a web search, you can't find anything on celebrities who may have done Sculptra or overdone it with Sculptra, because there really isn't a way to know if someone has had it unless that celebrity or person openly admits to it, because it's natural looking due to the fact that the results are from your own collagen and elastin, which is a natural component of our skin. In all my history of using Sculptra, and I've been treating patients with it for over 10 years, I've never said, oh my gosh, we did way too much Sculptra, you built up too much collagen and now you look weird. As a matter of fact, if anything, it's the opposite, where someone wished they had more results. When people say Sculptra is unpredictable, it's not because you can build up too much collagen and look weird. It's because biostimulators like Sculptra rely on your body's ability to create new collagen and elastin. So patients don't know the exact level of response they're going to get. Most of my patients have a good response. Some have a fantastic response. Like the woman we mentioned in this last video, is Sculptra the new facelift alternative? And in others, they have a minimal response. But if you have a mild response, that doesn't mean you're never going to reach your desired results. It just means that it may take more treatments for you. And the person who said she had the worst reaction to Sculptra and she's in constant pain to where her face swells up and down, reactions to Sculptra like this are very rare. It's still possible, but it likely wouldn't cause these symptoms unless you got some sort of infection. So my question for this Reddit post is, did she get the real authentic product injected? I hate to tell you, but there is a real black market for injections. Just over a month ago, a woman in Massachusetts who had done thousands of illegal fake counterfeit injections, including Sculptra, was arrested. And this is why I tell people not to price shop and just go with the cheapest price per vial. You are not just paying for the product, you're paying for the expertise, the skill, safety, and peace of mind. In both these instances, the aesthetic provider you choose is going to need to know if you're a good candidate for Sculptra, where to inject to get optimal results for your unique facial anatomy and not cookie cut. They're going to need to know how much to treat you with, how often they should see you back, and how often you should get retreated to maintain your results, because Sculptra is not as much of an exact science like filler is. So if you want to learn more about Sculptra, watch these videos next.